Doctor, you can start now.
Okay. Good morning. Today's topic is Rktpt. Rktpt, we know it is bleeding disorders. All the bleeding disorders described in modern medicine can be treated under the Rktpt mentioned by our acharyas. Rktpt, the bleeding disorders. In mythology, according to our mythology, the origin of the disease, Rktpt, appeared after Jwara because of the heating effect of later. Rktpt is a serious disease and it afflicts the patient with a great speed like fire. It manifests itself and affects instantaneously. We know the quoting Mahagadam, Mahavegam, Agnivat, Shigrakari cha. Agnivat Shigrakari means it affects like fire. Here, the blood or the recta is vitiated by pitta, flows out of the openings of the body. Already I explained the mythological origin, appeared after Jwara due to its heating effect, and we call it as Agnivad Shigrakaricha. What is the definition of Rektapitta? As per the definition, it is Samyogat, Dushanat, Samanyat, Gandhavarnayoho, Rektapittam Rektapittam Manishihi. Samyogat, Dushanat, Samanyat, Gandhavarnayoho. In Charagam Nidhanasthanam, it is explained as Lohita Pittam. Rektayuktam Pittam Rektavittam, Rekte Dushe Pittam Rektavittam, Rektavat Pittam Rektavittam. All these are niruktis of Rektabittam. Once again, I will explain Rekta Yuktam Pittam. It is we call as Samyogat. Rekte Dushe Pittam and Rektavat Pittam. Here we are saying Samanyat Gandhavarnayoho. Pitta is called Rekta Pitta. 1. It is combination with Rekta. 2. The vitiation of Rekta. And the third one, it is similarity in respect of smell and color with Rekta. In living beings, the channels of circulation of blood, the Rektavaha Srotas, are controlled by Pliha and Yakrit. In Rektavitta, Rekta is vitiated by Pitta. So, Pliha and Yakrit are the locations of Rektavitta. Rektavitta-prakopastu khalu pura dakshayajnodvamse rudrakovam amarshaknina praninam parigata sharira pranana abhavat jwaram anu. What is the relationship between Rekta and Pitta? The Rekta Dhatu is concerned with Jivana Karma. We know the karma of Rekta Dhatu is nourishing property, Jivana Karma, which is performed by its inherent Pitta dosha with the help of other two doshas through the process of Dhatu Parinama. Rekta Dhatu is concerned with Jivana Karma. There is an Asrayi Bandham between this Rektam and Pittam. The dependence of Rekta on Pitta is again increased when we consider the fact that Rekta Dhatu is produced in Yagrit and Pliha. Even though Yagrit and Pliha are the centers of production of Rekta, these are actually centers with Pitta dominance and they are connected with Pitta sthanas. There is a sloga in Ashtanga Hridayam Sutrasthanam. Nabhirama Swedo Lasigha Rudiram Rasaha Driksparshanam cha Pittasya Nabhiratra Visheshadaha. While considering the sthanas, there is a term Nabhi which is the main center of Pitta, denotes the middle part of the body. Nabhi means middle part of the body. In middle part, apart from Amashya, the two centers is Yakrit and Pliha are the centers of Paitika activity. Then the Asrayi Bandham, in Asrayi Bandham, the dosha is called as Asraya and Dhadu is called as Asrayi. While considering the Rakta Pitta and Rakta Dhadu and Pitta dosha is the functional unit and Kapha dosha is the precursor and Vada dosha is the propagator. What does it mean? Let's see. For Vada, what is the function of Vada? To help the circulation of Rakta, and for Kapha to provide nourishment to Dhadus. Both of them have to depend upon the status of Pitta dosha. The status of Pitta dosha determines whether to function normally or not. Such a relationship between a dhatu and its inherent dosha is termed as Asrayi Bandham. The functioning of dhatu depends upon the status of inherent dosha. Hence, the dosha is called as Asraya and the dhatu is called as Asrayi. We have to discuss the symptoms and the treatment of Rakta Pitta. We should thoroughly know what is the relationship between Rakta and Pitta. That's I am explaining here. This relationship is as much as we can sometimes use the Pitta instead of Rakta. Pitta is the complete functional capacity of Rakta. Without Pitta, Rakta Dhatu is nothing but the precursor of Dhatu, the Rasadhatu in turn the Asrayi of Kabhadosha. Hence, it can be said that such a combination of two doshas, when propagated all over the body by Vada dosha, the Jivana function of Rakta Dhatu is satisfied. So, for completing the function of blood, that is the Jivana karma, it needs Pitta, Kapha and Vada also. Therefore, the Rakta Dhatu, the Pitta dosha is the functional unit, Kapha dosha is the precursor and Vada dosha is the propagator. We know during Dhatu Parinama, the Rakta Dhatu is converted into Saramsha and Kittamsha. In the case of Saramsha, it is converted as Mamsa Dhatu, that is the Saramsha. And Kittamsha is said to be the Pitta dosha. Hence, the Pitta in the way formed influences its Asrayi. The influence is very much important as this has a double effect on Rakta Dhatu. That is, when a derangement in Rakta Dhatu is transmitted to its product, that is the Pitta dosha, it increases the derangement as the Rakta Dhatu is completely dependent upon the Pitta dosha. Next is Sroto Pariksha. The examination of Raktavaha Srotas, because the Srotas involved in this disease is Raktavaha Srotas, consist of the evaluation of the status of dosha with respect to the Rakta Dhatu. For assessing the status of Rakta dosha, we should know the Vriddhi Lakshanas and Kshay Lakshanas also. While moving to the Srodho Pariksha, first we should know what is Vishuddha Rakta. Vishuddha Rakta in Charakam Sutram 24/21 there is a sloka Tapaniyendra Gobhavam Patmalaktaka Sannibham Gunchabala Savarnam Cha Vishuddham Vidhi Shonitam. And there is one more sloka in Charakam Sutram 24/23 The meaning of that sloga is the person having normal recta present with a pleasant feeling of indriyas, regular ahara parinamas, happiness, normal physique and strength. Then how we can do the Srodo Pariksha. First, we should assess the Vishuddha Rekta Lakshana. If the blood is Vishuddha Rektam, then there is no chance for Rekta Pitta. So, where Rekta Dushti occurs, the Rekta Pitta occurs. While moving to the Srodo Pariksha, for the convenience, the Srodo Pariksha can be done by evaluating the Dosha Koba Lakshanas in 5 dimensions. These 5 dimensions are the Varna, Sparsha, Gandha, Rasa and Skandhana. Normal red like Indra Goba insect, Padma, Padma Laktaka Sannibham, lotus, then lac and molten gold. If there is a Vadavriddhi or Vadadushtam, Shyavam, Neelam. If there is Pitta Dushtam, Pida, Harida Chaya, Kabadushtam, Pandu Chaya. Next dimension is Sparsham. Normal is Dravam Snigdham Mridu and Pichilam Mandham Ashidoshnam, neither hot nor cold. Asamhadam and Lagu. While it is Vada Dushtarektam, it is Drava, Ruksha, Mridu, Ishada, Sara. Sara means quick flowing. Ashidoshnam, Asamhadam, and Lagu. While it is Pitta Dushta, it is Tanudravam, less dense fluid. Snigdham, Mridu, Vishadam, Saram, Ushnam, Asamhadam, and Lagu. Kabadushta is Sandra Dravam, that is dense fluid. These are the qualities. Next is Gandham, that is smell. Normal is Visram or Loha Gandham, iron smell. If it is a Dushta Rekta, the smell changes according to the Dosha Dushti. If it is Vada Dushtam, it is Visra or bad smell. Pitta Dushta is Ati Visra, foul smell. And Kabadushta is Alpagandha and Madhuragandha. And Rasa, the taste. Normal is Kinchit Levana Madhuram, slightly saltish. Vadadushtam is Kashaya Anurasam, slightly astringent. Pitta Dushtam is slightly bitter, Tikta Nurasam. Kabadushtam is Madhuradikyam or Levanadikyam, very sweet or very salty. Then what is Kandhana? There is a term Kandhana, is coagulation. Normal is clothes within a reasonable time. Vadadushtam Askandhana or Chirat Skandhanam. Doesn't load or clothes very slowly. Pittadushtam Askandhanam. Kabadushtam Shigra Skandhanam, which clothes very quickly. Then for bleeding, there is a chance to injury to the Schroders. The injury to the Schroders may be external or internal cause. It will show the symptoms of Shyavangada, Jwaram, Daham, Panduda, and Rekta Shrudi, Rekta Netrada, which is explained in Sushrudam Shariram 9/17. Then, while moving to the Nidana, while considering the Nidanam, normally there are Samavai Karanam, Asamavai Karanam, and Nimitta Karanas are there. What is the Samavai Karanam of Rekta Pitta? Samavai Karanam of Rekta Pitta is the Dosha, Pitta Dosha. And Asamavai Karanam is the relationship between Rekta Dhatu and Pitta Dosha. Relationship between Rekta Dhatu and Pitta Dosha. Due to the fact that this reaction can never be separated from clinical picture of the disease. These two are more related to the Samprapti rather than Nidana of a disease. the Samavai Karanam and Asamavai Karanam. The Nidanas mentioned in our textbooks on the causation of Raktapitta are all Nimitta Karanas. Are all Nimitta Karanas. The Nidanas mentioned in our book are all Nimitta Karanas. While explaining in detail, there is Abatyacharanam. Abatyacharanam is due to Asatmendriyartha Samyogam. Abatyacharana can be in the case of Ahara and in the case of Vihara. In the case of Ahara, the food with excessive amla rasam, kadu rasam or lavana rasam, the food with kadu, amla, lavana, kshara, tikshna, ushna, vidahi and viruddha properties cause pitta dushti and this leading to rakta dushti. The viharas and the gunas intake of excessive vidahi. Vidahi means improper digestion leading to burning sensation of food, and tikshna means sharp and hot and alkalis. These types of ahara causes rektapitta or these apatyajaranam are due to our asatmendriyartha samyogam. Then vihara, the practice of ayasam, adavam, analam causes pitta koma and lead to rektapitta. Adavam means excessive exposure to the heat of sun. Vyayamam means excessive physical exercise. Vyavayam is excessive indulgence in sexual activities. Adva is excessive walking. Pratnyabaradam. In the beginning, we said that Rudrakopa is the main cause of Rektapitta. That Rudrakopa we can consider under the term Pratnyabharadam. Manasika Vikritis, Krodham, Bhayam and Shoka has a provocative effect on the Pitta dosha and this may lead to the manifestation of Rektapitta. Kopamus, anger and shoga also leads to rektapitta, that is excessive grief. Parinama. Parinamam is seasonal and diurnal provocation of pitta. Pitta may be provoked in Sharat Ritu. Pitta provoked in Sharat Kalam and during midday and in midnight. This Pitta Kopa, when accompanied with Rekta Dushti, may lead to the manifestation of Rekta Pitta. It leads to the manifestation of Rekta Pitta. These are the Nidanas explained in our classes. While moving to the Samprapti or the pathogenesis, having discussed all the possible Nidanas of Rekta Pitta, now let's move towards the Samprapti of the disease. When various nimitta karanas vitiate the pitta kopa, which in turn vitiates rekta dhatu, these samavai and asamavai lead to manifestation of the disease of rekta pitta. In addition to pitta dosha, sometimes kabha and vada or both may be present as anubandha dosha. When Kapha dosha is accompanied with Pitta dosha, the Rakta pravritti will be in upward direction. This is due to the fact that upper part of the human body is more Slaishmikam. When Vada becomes the Anubandha dosha, Rakta pravritti occurs in the downward direction as the lower part of is Vada predominant. When both Vada and Kapha are vitiated with Pitta, Rakta Pravritti occurs in both upward and downward direction as well as through the hair follicles. Susruta says that Rakta when becomes Pitta predominant reaches the Amashya And then according to Anubandha Doshadikya, the root of Rekta Pravritti is determined. That is, Rekta, when become Pitta predominant, reaches Amashya. In Amashya, uh, it associates with the Anubandha dosha, and depending upon the Anubandha dosha, its Gadi is determined. Here also note that some acharyas opine the blood to coming from Pliha and Yakrit. Thus, the pathology of Rektapitta can be elaborated in this way. The Nimitta Karanas, when practiced in excess, at first causes some amount of Rasadushti. Nimitta Karanas causes some amount of Rasadushti. When this Rasadhatu is vitiated, the Dhatu next it is bound to be vitiated as Rekta Dhatu. Pitta is considered as Pitta Amsham of Rekta Dhatu, hence Pitta is also vitiated. Up to this stage, there will only be prodromal symptoms present. When Pitta is vitiated, it will make Rekta more vitiated by mixing with it. These two together reaches the Amashya and Pakvashya. When this two reaches Amashya, there is two will be accompanied by vitiated Kabadosha. This lead to the bleeding in upward direction, which is called as Urdhvagata Rektapittam. When the vitiated Rekta and Pitta reaches the Pakvashyam, and this will be accompanied by Vada. This may also happen when Urdhvagata Rektapittam is left untreated for a long time, or when the patient is very much suffering from apatarpanam. These two cases also lead to adhogata rektapitam. When urdhagata rektapitam is left untreated or the patient is suffering from apatarpanam. All this condition is vada dominant. And in these cases, bleeding will occur in downward direction. This may also happen in another way. That is, when the amount of blood, amount or Rektadushti and Pitta Kobha are more, it is likely to affect the succeeding dhatus, this Mamsam Asti, which are Vada predominant. This way also, Vada get accompanied with Rektam and Pittam. All these types of Rekta Pitta show characteristics of bleeding in downward direction, which is called Adhogata Rekta Pittam. When both Vada and Kabha accompany Rekta and Pitta, this affected individuals is likely to have bleeding in both directions. Also, in such cases, when the extent of when the extent of Dhatu Dushti reaches more deep, Rekta Pravritti may occur in Shakas as the time apart from Amashya and Pakwashi. The whole body is having Pitta dominant Rekta. Hence, blood oozes out from hair follicles. Apart from having bleeding in both upward and downward directions from gastrointestinal tract. This type of Rektapitta is called Ubhayaga Rektapittam. From these descriptions, it can be deduced that the pathogenesis of Rektapitta is very much linked with the status of Agni and Dhatu metabolism of the individual. The food with pungent, sour and salty taste with acidic natures make the Agni more Tikshna or Vishama. The emotional stages of Bahya, Shoka and Krodha make Agni Mandhyam or Vishamagni. All these three forms of Agni, that is Tikshnagni, Mandagni and Vishamagni, are abnormal and creates a fair amount of Rasadushti. The vitiated Rasadhatu causes derangements in Dhadu's metabolism and the extent, which depends upon the status of Agni itself. Due to this derangement in Jadaragni, both Dhatokni and Bodhakni become deranged. These errors are responsible for various complications of Rktpt, which are Daurbalyam, Arochikam, Avibhagam, Shwasam, Kasam, etc. Uh, if we say, if we summarize or if we say the Samprapti in few words, in the disease, Rktpt develops and manifests as pathogenesis runs through the below mentioned steps in that order. Pitta aggravated by the above said nidhanas and leaves its site and reaches blood. Being a Pittamsham of Rakta, the Pitta on getting mixed with Rakta attains quantitative increase. The Pitta in turn vitiates the Rakta. Due to the heat of Pitta, the Dravadhadu or the liquid portion of the tissues like Mamsa, Methas, etc. oozes out of their respective tissues and gets mixed with Rakta. This further enhances the quantity of blood flowing through the blood vessels, creating immense pressure in the blood vessels. Due to the pressure of the blood and heat of pitta, the walls of blood vessels get damaged and the blood starts flowing through various openings of the body. The bleeding occurs through mouth, nose, ears, skin, anus, penis, and vagina. This bleeding of blood vitiated by pitta through various orifices of the body is called Rktpt. The Pratyabhradam Aharam all causes Rasadushti, then leads to Rektadushti, and finally the Pitta Dushti. This, these three are the main steps in pathogenesis. We already discussed Anubandhya dosha as primary. Primary or Anubandhya dosha means which is capable of manifesting its signs and the symptoms. Anubandha dosha is doshas become associated in markam. Then moving to the Purvarupa, let's evaluate the Pragrupas mentioned by Vagbhada. First one is Shirogurutam. Why Shirogurutam occurs as a prodromal symptom or Purvarupa of Rektavitam? The heaviness of the head is due to resection. The vitiated Rasadadu create errors in the functioning of Buddhi and Manas, thus leading to Shirogurutvam. Then next one is Aruchi, loss of appetite. Aruchi is actually due to Jadaragni Mantyam and Rasadhadu Kshayam. Shirecha, desire of cold, is due to Pitta Kobam. Hence, it is a sign of advanced pathology of the disease. Dhumakam. Dhumakam, Amlakam. These both are similar. Dhumakam is burning sensation. Amlakam is acidic regurgitation. Dhumakam, the burning sensation in the stomach, may develop as at two different stages of Rektapitta. Dhumakam, first Tikshnagni lead to Dhumakam. If the Agni is Tikshnam, it will lead to Dhumakam. And then Pitta Goba also lead to the development of Dhumakam. Same causes leads to Amlagam also. Amlagam is acidic regurgitation. Chardi. Sixth one is Chardi. It may occur in Rasadushti, Agni Vaikunyam, Rektadushti or Pitta Kobam. Then Chardita Bhaibalsyam. Chardita Bhaibalsyam is disagreeable feeling towards the vomiting. It's a prodromal feature of Rektapitta. Why it occurs, develops due to Rasadushti or Pitta Kobam. Both has this Rasadushti and Pitta Kobam has its effect on the mind by which such feeling is developed. Kasam, cough may develop due to Agnimandyam or due to Rasadushti. This creates a fair amount of ama in the amashya, which leads to the development of kasam. Shwasam is dyspneas developed for the same reason as the cough, but due to their increased severity. Brahmam is fainting. Fainting may develop if there is Rasakshayam, Rekta Dushti, as well as Pitta Kobam if left untreated. More commonly, Rasadhadukshayam is the cause of Brahman. Clamam is due to Rasadhatu Kshaya. Loha Lohida Malsyama Gandhasyatvam. The smell of iron, blood, fish, and indigested food may be present in the mouth as a prodromal symptom of Rktpt. This characteristic smell is due to Pitta Kopa and it differs according to Anubandha Doshadikyam and the extent of Doshakopam. Then Swarakshayam, difficulty may develop in phonation at the premonitory stage of Urdhagata Rektavitam. This is due to the Kshayam of Rasadhadu. Nayanadishu Rekta Haridra Harida Varnada. Color change in Nayanadishu. Why this sign indicate the advanced stage of pathogenesis, very much near to the manifestation of disease. While the ruba is developed or very much close to ruba, this feature Nayanadishu Rekta Haridra Harita Varnatvam is visible. Neela Lohita Pidanam Varnanam Avivechanam, inability to distinguish between the colors blue, red, and yellow may be present in the course of pathogenesis of Rktpt. This is due to the Pitta Koba and hence it indicates the manifestation of bleeding disorder in the very near future. Swapne Tadvarna Darshitum, appearance of these colors, blue, red, and yellow, in the dream is a prodromal symptom of Rktpt. It is due to Pitta Kopa, and this prodromal symptom mostly develops in the patient with the Paitika Sharirya Prakriti and Rajasa Manasa Prakriti. This is the advanced stage in the causation of the disease. Rubam. The clinical picture of Rktpt compromises of episodes of bleeding without any apparent cause. The bleeding may occur through the natural orifices and through the hair follicles. This route of Rekta Pravritti depends upon the type and the severity of Rktpt. Bhedam, there is Vadikam, Paitikam, Kabajam, Sanipadikam, Vadapaitikam, Vada, Pitta Kabajam, and Kabhavadacham. This is actually based on the Anubandha doshas, and while treating a patient, we consider the Urdhagada, Adogada, and Ubhayaga types. Based on the Gadi, we are treating the Rktpt. Then Rktpt has to be differentiated from Abhigada, Rektadisara, Rekta Arshas, and Rekta Pradhara and Rajekshma. It has to be differentiated from Abhigada, from Rekta Adisara, Rekta Arshas, and Rekta Pradhara and Rajekshma. Before that, there is a small topic, that is the generalized bleeding disorder. This I will discuss later. That is, while comparing the types in modern pathology, there is, based on the cause, a defect in hemostatic mechanism. There is inherited hemorrhagic disorders and acquired hemorrhagic disorder. Here I just mentioning these two causes are as two types. Then while moving to differential diagnosis, Rktpt has to be differentiated from Abhigada from Rekta Adhisara, Rekta Arshas, Rekta Pradhara and Rajakshma. In all these disorders, there is bleeding. In case of Abhigada, the blood that oozes out is not vitiated. Hence, it can be differentiated from the vitiated blood by the absence of Pittadhikyam. Such blood coagulates readily unless a sira or dhamani is torn. It is important to investigate into the cause of bleeding in order to avoid the possibility of abhigada in every case of Rktpt. In the case of Rakta Adhisara, the second one, Rakta Adhisara, the bleeding will not be profuse and it will be mixed with feces. There will be Pitta Koba Lakshana such as Daurgandhyam, Trishna, Murcha, Daham, etc. And the anus may be injured. Whereas in case of Adogada Rektapitta, bleeding will be severe and will show Vada Koba Lakshana like Rukshada, Karshyam, etc. In Adogada Rektapitta, Vada is associated with it. Then Rekta Arshas. In every case of Adogada Rektapitta, with the symptom of bleeding per rectum, the possibility of Rekta Arshas should be excluded by looking for any Gudanguras in or around the presence, in or around, and presence of symptoms like Udavartam, Agnimadhyam, Malabandham, etc. So, examination is very much important here. If these symptoms are present with the existence of red-colored ankuras in either of the three valleys of Guda, the bleeding per rectum is due to Rekta Arshas. Next is Rekta Pradharam. We should differentiate Rekta Pittam from Rekta Pradharam. When bleeding occurs only per vagina without any apparent abnormality in lower genital tract, it is mostly due to Rekta Pradharam. Rekta Pradhara can be differentiated from Rekta Pitta due to the fact that in later, bleeding will never be only per vagina but will occur through other orifices also. That is in Samprapti of Rekta Pitta. Before it is localized in yoni, it should be reaching the amashayam from which bleeding may occur through mouth or per rectum. So, study or understand the pathology thoroughly, then we can differentiate Rekta Pradhara and Rekta Pitta. In case of Rajakshma, blood may be seen as streaks in sputum. Here, this mixture of blood and phlegm is differentiated from Paitika Rekta accompanied by Kabha and in Urdhagada Rektavita. The former is Vada predominant condition with expulsion of Kabha and Rekta, whereas the later is Kabha predominant condition with expulsion of Pitta and Kabha as a vehicle. Urdhagada Rektavittam is Kabha predominant. But in Rajakshma, Vada is predominant. Both are systemic disorders with removal of blood from body leading to emaciation of patient. But due to the fact that blood which is expelled in Rekta Pitta is Pitta rather than Rekta, and the Pitta turned Rekta is not essential sign of functions of the essential sign of functions of the individual. The sign of Dadukshaya will be more in case of Rajakshma. Dadukshaya symptoms will be more in Rajakshma. Apart from systemic disorders, Rekta Pravritti may occur from any of the Bahya Srotas as a result of various diseases. Such disorders should be considered. See the differential diagnosis of Nasasrita Rektapitam, that is bleeding through the nose. That is to be differentiated from Dushta Pradishyaya, Puya Rektam, Nasa Arshas and Nasa Arbudam. The first one, Dushta Pradishyaya. In Here we are not dealing in detail about all these diseases, just understanding how we can differentiate it from Nasasrida or the specific type of Rektapitta. In Dushta Pradishyayam, blood may come from nose mixed with phlegm. In Puya Rectum, in the Snasaroga, blood and pus may come from the nose. Nasa arches, this may bleed from abhighadam or from any pathology involving Rektakoba, as in the case of arches. Nasa arbudam. This may also lead to bleeding for the same reason as in Nasa arches. We can correlate it with, compare it with epistasis. In epistasis also, causes are mentioned. Local causes like trauma, infection, then physiological epistasis is there, congenital is there, and some systemic disorders also causes epistasis. Epistasis means bleeding from the nose, nasal bleeding. It's a very common condition. The anterior inferior part of the nasal septum is the commonest site of bleeding, and it is termed as little area, that you all know. And this is a highly vascular area, making the anastomosis between the branches of various blood vessels like anterior ethmoid artery, palatine artery, greater palatine and artery, and superior labial artery. So the main causes of bleeding from this area are, one is local trauma, then infection like acute rhinitis or adenoiditis, etc. Then there is physiological epistasis, violent exertion or excitement, extremes of heat and cold, and extreme alteration of pressure, etc. causes bleeding through nose. Then congenital causes like telangiectasia, tumors, juvenile angiofibroma of the nasopharynx, hemangioma, then inverted papilloma, malignancy of the nose, and paranasal sinuses also causes bleeding. Then systemic diseases like hypertension, bleeding dialysis, leukemia, anemia, uremia, exanthematous fevers like measles, mumps, and typhoid, etc., causes bleeding through nose. Hormonal factors like puberty, pregnancy, granuloma gravidarum, then some idiopathic causes also causes bleeding through nose. Next is Karnasrita Rektapittam. Here we have to differentiate this Karnasrita Rektapittam from Pittaja Karnashula and Rektaja Sannipatika Karnashulas and Karna Arshas, Karna Arbudam and Karna Vidradhi. Pittaja Karnashula, blood may come from the ear with a mixing of yellow color and the signs of Pittakoba, and Rektaja Karnashula, it is caused by Rektadushti and Abhigadha and may lead to bleeding with same symptoms of Pittaja Karnashula. It is explained in Ashtanga Hridayam, Uttarasthanam, 17th chapter. Sannipadika Karnashula, it may lead to bleeding with a spectrum of colors mixed with it. Similarly, we have to differentiate this bleeding through ear or Karna Gada Rektapittam from the Karna Arshas, Karna Arbudam and Karna Vidradi. These disorders may lead to bleeding from the ear. Then Netrasrita Rektapittam. It has to be differentiated from allergy, Rektasravam, Parvani, Puyasravam, Arjunam, Rekta Abhishyantam, etc., which is also explained in Ashtanga Hridayam Uttarasthanam. Then allergy, this is a Vatmaroga, may lead to blood and pus discharge when it bursts. Rektasravam, it is a Sandhi Roga, bloody tears are expressed. Parvani, it's also Sandhigata Roga, may lead bleeding when Pidaka burst. Puyasravam, in Puyasravam, blood and pus comes out from the Kaninika Sandhi. Arjunam, this is a Shukla Gadharogam and is characterized by the presence of spots in the sclera like the blood of rabbit. Note the point, Arjunam. And Rekta Abhishyandam, Sarvakshirogam with bloody tears and red dots in sclera. Asyagada Rektapitam. Asyagada Rektapitam, bleeding from mouth due to local causes like Rektoshta Kobham. Rektoshta Kobham, bleeding from the lips. Shidadam, it is a Dhandamula Rogam in which provoked Kabha and Rekta lead to bleeding from the gums. Ubakusham, it is also a Dandamula Roga and is characterized by Dandhamamsapagam, Rektavarnam, Kantu and Rektasruti. All these are explained in Ashtanghrudaya Muttarasthanam 21st chapter. Dandavidradi, it is also a Dandamula Roga with a severe pain and discharge of pus and blood from the gums. All these we can differentiate or we can understand by proper examination of the patient. Mahasushiram, it is a Dandhamula Roga. The blood and pus oozes out from the gums with the symptoms of Sannipada Jwara. Apart from the local causes, blood may come from mouth in Paitika Chardi. And in Paitika Chardi, blood is present in the vomitus as this may occur as a complication of Rajakshma. Metrasrita Rektapitam. Bleeding may occur through the penis due to the lesions of the penis and also due to some Mutragata rogas. It has to be differentiated from Rektobadamsham, Guhyarshas, Avapadika, Ashmari, Ushnavadam and Mutrasadam. First is Rektobadamsham, disease of penis characterized by dark sporas in the penis with bleeding. Then Guhyarshas, this may leads to bleeding from penis resembling due to Rktpitta. Avapadika, this is the rupture of the foreskin leading to the bleeding from penis. Ashmari may lead to blood in urine when Kshata occurs due to the Sankshobha of Ashmari. Ushnavadam, this is a Mudragada Roga in which due to the Adivyayamam, Tikshna Aharam, etc., urine may become mixed with blood. Then Mutrasadam. In this Mutra Roga also, the urine may show different colors, including the color of blood. So, assess the Nidanas, Lakshanas, proper examination, and then differentiate Rktapita from other diseases. Yonyasrita Rektapitam has to be differentiated from the diseases like Vadigi, Adisharana, Paitigi, Rektayoni, Paripluda, Ubapluda, and Asrudharam. Gudasrita Rektapita has to be differentiated from Rektarshas, Parikartika, and Bhagandaram. Bhagandaram, which is of 8 types. Then Sadhya Sadhita. The Rektapita is associated with one dosham as Sadhyam, that is, it is curable. Two dosha is Kruchra Sadhyam or palliable or Yapyam. If all the three dosha are associated with Rektapita, then it is Asadhyam. In Ashtanga Hridayam, Chikitsa Sthanam, Acharya starts the treatment by explaining the prognosis. That is, when a patient comes in front of you with Rktapita, first you have to assess, is this treatable or no? Urdhugam balino avegam egadoshanugam navam रक्तपित्तं सुखे काले साधयेत् निरुपद्रवम्. साध्य रक्तपित्तं. Then अधोगं यावयेत् रक्तं यच्च दोषद्वयानुगं शान्तं शान्तं पुनः कुप्यन् मार्गान् मार्गान्तरं चेत् अधिप्रवृत्तं मन्दाग्ने त्रिदोषं द्विपदं त्यजेत्. ऊर्ध्वगत रक्तपिता, which is kabhanubandham, is sadhyam. Adhoga, which is vadhanubandham, is yapyam. Ubhaya, which is vadha kabhanubandham, is asadhyam. It also becomes asadhya in the following conditions. If the patient is having mandagni, less power of digestion or metabolism, it is difficult to treat. Adivegavat, if the disease has an acute attack, if the patient is emaciated by diseases, or if he is having Kshina Deham, the patient is debilitated. If the patient is an aged patient or Vruddha, then it is very difficult to treat such cases. It's also asadhyam. Then Anashana, if the patient is not able to eat, when the bleeding take place in excess through either of urdhva or adhomarga. Punabagandhi, when the blood has a smell like that of dead body. Krishnavarnam, when it is exceedingly black in color. When it gets obstructed in throat. Upadrava Sahidam, when it is associated with all the complications. Here, Susruta explained 18 Ubadravas of Rktpt. They are Daurbalyam, Shwasam, Kasam, Jaram, Vamadu, Panduda, Daham, Murcha, Bhukte, Ghoro Vidaham, Adradhi, Krityatulya, Pida, Trishna, Koshtasya Bhedam, Shirasi Chatarpanam, Podinishtivanatvam, Bhuktadvesham, and Avipagam. Let's consider one by one. First one is Daurbalyam. In Rktpt, Daurbalyam is a main complication or Upadrava. Daurbalyam means weakness is developed due to general Dhadukshayam. The huge loss of blood disables Raktadhadu to nourish the succeeding Dhadus. They suffer from Dhadukshaya and cause general weakness of the body. Then Shwasam, dyspnea develop as a result of Kabhakopam. As a result of imbalance between the doshas, the Kabhadosha gets provoked and manifests as Shwasarogam. As there occurs Kasam as a prodromal symptom in Urdhvagata Rktpt, it may naturally complicate as Shwasarogam if not properly managed. Then Kasam, cough, same reason like Shwasarogam. Jaram is developed as a result of utmost Pittakobam. It is an indication of Dhadu Pachanam. To occur Jara as a complication, there will be greater amount of derangement in Dhadu metabolism. This type of Jara will not respond to usual Jara Chikitsa as it is Dhadugada Jaram. Note the point, this is Dhadugada Jaram. Then Vamadu, vomiting develops in Urdhvagata Rktpt as a complication. Then Madam, feeling of intoxication is developed as a result of Dhadukshayam. It occurs especially when Amadosha is not adequately treated. Panduda, that means pallor. Pallor may develop as a result of Dhadukshayam and Pitta Dushti. When Jivana Karma of Raktadhadu is disturbed, the Dhadus are not nourished well, thus leading to the development of pallor. Daham, burning sensation, is developed as a result of utmost Pitta Kopam. Murcha is fainting. Fainting may develop as a result of Dhadukshayam and Pittakopam. Here, the ultimate Dhatu, that is Ojas, may be involved. When this occurs, some irreversible changes may be present and such cases are resistant to the treatment. Then Bhukthe Goro Vidaham. After food developed due to Pitta burning sensation develops Adhradi. Adhradi means loss of patience. Hridya Tulya Pidha, pain like that of Hridrogam. When Rasadhadukshayam is severe, there is severe pain in such cases. Then Trishna, that is morbid thirst, is developed due to the utmost Pitta and Koshtasya Bhedam. Koshtasya Bhedam, diarrhea is developed as a complication, especially in Adogada Rektapitam. The frequent bleeding in downward direction lead to more Vadakopam and which culminates into diarrhea. Shirasi Ichatarpanam, headache will be there. Pudinishtivanatvam, spitting of putrid material is present. When Kabha reacts with Pitta turned Rekta, Pudinishtivanatvam is developed as a complication. Then Bhukta Dvesham, disliking for food. Disliking for food is due to one is Hamadosham and there is Apathya Bhojanam of the patient, which leads to the increase in Hamadosham. And the complication occur more frequently in case of Urdhagada Rektabittam. Then Avibhagam, that you all know, it is indigestion. Then, what are the screening tests done in case of bleeding disorders? The screening test is done in cases bleeding disorders. One is platelet count, prothrombin time, and the test for platelet function like bleeding time, Hess tourniquet test, tests for platelet adhesion. And the tests for coagulation are floating time, float retraction time, and prothrombin time. Then, coming to Chikitsa, the treatment of Rektapittam is Pradhimarge Haranam Rektapitte Vidhiyate. The chikitsa of Rektapittam depend upon the types and the severity. And the main treatment is Pradhimarga Haranam, or in which direction bleeding occurs, the treatment should be in the opposite direction. In Ashtanga Hridayam, it explains that Sandarpanodham Balino Bahudoshasya Sadhaye Urdhvabhagam Viregena. That is what is mentioned in Charagam Nidanam Pradimarga Haranam. Sandarpanodham Balino Bahudoshasya Sadhaye Urdhvabhagam Viregena. Vamanena tu Adogadham. Adogada Rektapita, Vamana is the treatment. Shamanehi Brahmanesha Anya Lengya Brahmyan Avekshacha. Shamane Brahmanesha Anya Lengya Brahmyan Aveksha Cha. That is Sandarpanodham Bhalavan Bahudoshaha Pratiloma Shodhanam Apatarpanodham Urdhagada Rektapittam Shamanam, and in Adogada Rektapittam we have to do Brahmana Chikitsa. Then, as all the type of bleeding is stoppable, or can we stop the bleeding? Is it desirable? In Ama stage, in Ama Avastha, or if the patient is strong, it is better to avoid such cases. That means, if the cause of Rektapitta is Sandarpana and the patient is Akshina Balamamsaha, the stoppage of bleeding is not desirable. Stoppage of bleeding is not desirable in case of Akshina Balamamsaha and the cause is Sandarpanam. If the bleeding is stopped in the beginning, then it may cause Galagraham, Pudinasyam, Murcha, Aruji, Jwaram, Gulmam, Pliha, Anaham, Kilasam, Varnanasham, Bhagandaram, and Buddhi Indriya Ubarodham. Buddhi Indriya Ubarodham. Lankhanam and Tarpana are the main treatments. In Urdagada case, we have to do Virejanam plus Tarpanam. For that, we can use Madhura Kashaya and Tikta Rasas. Urdham Pravritte Shamano Rasau Tikta Kashayagau. Upavasasya Nishundi Shadangodaka Painaha. In Urdagada, Rektavitam. Fasting or Lankhanam is mentioned here. Amadoshodh Sharirinam Vriddhim Prayadi Pittasrit Tasmat Lankhanam Adidaha. In Charaga, it is explained Tasmat Lankhanam Adidaha. First, you have to do Lankhanam or Tarpana in the beginning by considering the track through which the disease is manifested and the association of doshas and the causative factors. Lankhanam Adidaha Marge Doshanubandam Cha Nidanam Prasamikshya. So, in the beginning, we have to assess the root of Rktpt and the causative factors of Rktpt and the Anubandha doshas of Rktpt. Lankhanam Rktpittado Tarpanam Va Prayojiye. While moving to Ashtanga Hridaya, it is explained as Adhoga Rektapitetu Brahmano Madhuro Rasaha Urdhuge Tarpanam Yojyam Peya Purvam Adhogade. That means Urdhagada Rektapita, the treatment is Virejanam. Then we have to do Tarpanam. For that we can use Madhura, Kashaya and Tiktarasas. In Adhogada Rektapita, the treatment is opposite direction. So Vamana is the treatment. Then give Peya, Virejanam with Trivrit and Abhaya, and the fruits of Araguda, Trayamana, Gavakshi, etc. can be used for Virejana. Vamana with mantha prepared of Madana and added with honey and sugar along with additional sugar and water can be used. Vamanam Bhala Samyuktam Tarpanam Sasidamadu Sasidam va Jalam Kshaudra-yuktam va Madhukodakam Kshiram va Rasa Ikshurva Shuddhasyanandharo Vidihi. Yadhaswam Mandapeyadihi. Mantha or Peya we can administer. Then alleviation therapy to whom? Balamamsa Parikshinam. Akshina Balamamsaha, there is no need of stoppage of bleeding. But Balamamsa Parikshinam, we have to do alleviation therapy or Shamana Chikitsa. We have to do Shamana Chikitsa. Then Tarpanam, we already mentioned Sagradam, Laksha Churnam, Mandhagner Amla Satnyaya, some Tarpanam by adding Dadimam and Amalagam, Shali, Shashtigam, Nivaram, Koradusham, Shyamagam and Priyanku. This should be used as food by a patient suffering from Rektapitta. Mudgam, Masuram, Chanakam, Mankushta are also advised. Padola, Nimba, Plaksha and leaves of Vedasa are also advisable. Then meat soup like Kapoda, Lava, Shasha, etc. advisable. For gruels, by adding extract of Kiradadikta, Ushira and Musta. By adding extract of Harenuga or by adding ghee and extract of Bala, we can prepare the gruel. Then, if there is Vibhanda Abshesha Vastukam, Vadolbana condition, Tittiri Udumbara Rase, Mayuraha, Plaksha Niriyuhe, Kukudaha Negrodhasya. Use water boiled of bitter drugs, fruit juice, Vidhari Gandhadi, Sridashidam, Jalam. Then After ascertaining the nature of a subsidiary dosha, the strength and the diet of the patient, water should be given to him when he is thirsty and limit of satisfaction is reached, or in small quantities. Decoctions. Shira Prayoga as mentioned, if does not get alleviated even after the administration of decoction and by Agnidipti as well as alleviation of Kabha if Vayu is aggravated. Shira Prayoga can be done. Then moving to specific Mutragatha Rektapitta, specific types of Rektapitta. In Mutramarga Rektapitta, milk boiled with Shadavari and Gokshiram or Shalaparni, Krishniparni, Mashaparni and Mudgaparni immediately stops the bleeding. If there is bleeding from male urethra, the administration of Uttaravasti is very much useful, which is explained in Yoga Ratnagaram. And in Vaishajya Ragnavali, milk boiled with Trikandakam and Shadavari is explained. Bleeding from the penis, which is known as hematuria, that means there is presence of blood in the urine. In hematuria, that explains a test which is known as 3-glass test. The origin of bleeding can be localized by this urine test named as 3-glass test. This test, urine is collected separately at the start, middle and end of the mixturation. Both in initial portion, blood in initial portion indicates urethral bleeding. Blood in the terminal portion indicate the bleeding from the bladder, while uniform hematuria indicate upper urinary tract bleeding. Hematuria is to be differentiated from red urine. Red urine is due to the use of phenolphthalein, beetroot, etc. Also from hemoglobinuria. In case of red urine, microscopy can be used to differentiate, whereas in case of hemoglobinuria, centrifugation can be used for differentiation by which erythrocytes do not sediment. There are so many causes for hematuria. In brief, it is renal, ureteric, bladder, prostate, and urethral causes. Renal causes like Bern's tumor, that is nephroblastoma, hypernephroma, papillary tumor, tuberculosis, etc. And urinary causes, stone and neoplasm. Bladder causes are cystitis, tumor, stone, and tuberculosis. Prostate causes like BPH, carcinoma, and tuberculosis. Urethral causes neoplasm and injury. Bleeding through anus. In such cases, we are using milk boiled with mojirasam. Milk boiled with either vadavaroham or vadashungam. Then milk boiled with hriberam, neelolpalam and nagara. After taking this, the patient should take shali rice along with milk. Rekta Adhisara, Rekta Arshas Chigilsa are also mentioned here. Gudhamarge Visheshena Vasti. Like in the case of Mutramargika Rektapitta, Yogaretnagara explained Uttaravasti. Here, Gudhamarge Visheshena Vasti is mentioned. If there is excess bleeding, ghee should be given. Jangala Rudiram with Kshaudram or Amam Ajyam Yakrit Pittayudam as mentioned in Ashtanga Hridayam. We know bleeding per annum, it is melena, hematochezia. Bleeding per annum occurs in two forms. These are melena and hematochezia. Melena is the term used for the presence of altered blood in pieces, whereas hematochezia term used to denote fresh blood in stool. Bleeding from any part of the gastrointestinal tract proximal to the middle of the colon can give rise to melena. Bleeding lesions of large intestine or rectum generally give rise to hematochezia. Then causes are anorectal lesions, hemorrhoids, anal fissures, proctitis, trauma, and colonic lesions, neoplasms, and carcinoma. There are so many causes for bleeding per annum. Then the Agraushada Prayogam. The Agraushadam of Rektavitam is Vashya. Vashyarasena Bhalini Mridlodranchanamakshikam Pittasrikshamayetvitam Niryaso va Adarukshakat Sharkara Madhu Samyuktaha Kevalo va Shrudo Abiva Vrishaha Sadhyo Jayatyasram Sahi Asya Paramaushadam. This sloga is explained in Ashtanga Hridayam Chikitsa Sthanam. Here Acharya Vagbada says, Vrishaha Sadhyo Jayatyasram Sahi Asya Paramaushadam. The Agra Aushada of Rektapitam is Vasha. The scientific name is Adathoda vesica. The rasam of Vasha is Tikta Kashaya rasam, Shida Viryam, Kadu Vipagam, and Laguruksha Gunam. The chemical constituent present in Adathoda vesica is vasicin. The main alkaloid is vasicin. It is more abundant in the root bark. It is reported to be increasing the platelet count and thereby arresting the capillary bleeding. The Tikta Kashaya Rasa of Vashya are Pitta Shamanam and therefore very much useful in Rektabittam. And the Shida Virya is also alleviates Pitta, and the Kadu Vipaka and Lakaruksha Guna, even though aggravates Pitta, here they do not cause problem as they become subsidiary to the Rasa and Virya. There are so many preparations explained like Vashyagridam. In Ashtanga Hridayam, here it mentioned the Swarasam itself can be used, or we can use the Swarasa of Adathoda Vasika with the sugar and honey. Then Kashaya preparations are also, decoctions are also mentioned. Sarpir Guda mentioned in Urakshada can be used in Rektapitta. Shamana yogas like Palasya Valkala Kwadham, Palasya Valkalaha Kwadaha, Sushidaha Sharkaranvidaha, Pibedva Madhusarpirbhyam, used with the Madhusarpirbhyam, Gava Ashya Shakrudorasam. Palasya Valkala Kwadham is mentioned, and Shadavariyadi Gridam is mentioned. And some other medicines explained according to the conditions, like Sakshaudram Gradide Rekte, Lihyat Paravadam Shakrat, Adinisrada Rektastu, Kshaudrena Rudhiram Pipe, Jangalam Bakshet Ajamamam, Pittayudam Yakrat. Here, if there is clots of blood coming out, then Paravada Shakrat is mentioned with honey. And if there is excess bleeding is there, then Rudhira Panam itself is explained. Shida Kashaya of Chandanam, Ushiram, etc. is also advisable in the case of Rektabita. And after giving the Kashayas, when the Agni become normal and Kaba in Vijide position, Vijidaha, Kabhe Vijide or alleviated, then also there is bleeding or the disease is there, then we have to give milk that we already explained. One important point here noted to be is Panchagune Ambasi Gavyam. That means Gavyam Paiha with 5 times water is advised here. Then Vrisha Gridha, which is Gridha prepared with Vasha. The indication of Vrisha Gridha are Pitta Shonidam, Pitta Gulmam, Pitta Jura, Shwasakasa, Hridroga Kamala, Timira Brahma Visarpa, Swarasadhamsha, Nashaye. In the case of nasal bleeding, I will explain later. Before that, there are few external therapies also mentioned like Abhyangam, Parishegam, Segam, Avagaham, Shidavidhi and Shayanam, Veshma, etc. are mentioned. Moving to Kanthamargaga Rektapitam. In Kanthamargaga Rektapitam, Utpalanalaksharam with Madhu and Sarpas. In Kabhanubandhe, Kandhagade, Gradide. Rekte, Sapiche, Sakabhe, Gradide, Kanthamargage, Lihyat, Makshita Sarpabhyam, Ksharam, Utpalanalajam. Utpalanalakshara is mentioned here. Grana Margaga Rektapitam. Granage Rudire Shuddhe, Navanam Anushechige. Navanam is the treatment. After Shodhana, Navanam with Kshiram plus Sita or Kevala Jalam, Dadima Pushpaswarasam, Amrasti with or without Kshiram is advisable. Hematemesis. Hematemesis is the vomiting of blood, red blood or coffee ground materials. It is the most common presentation of upper GI bleeding. Melena develops as a little as 50 to 100 ml of blood loss in GI tract. Hematochezia already explained 1000 ml suggests lower bleeding source. Upper gastrointestinal bleeding present with hematochezia in 10% of the cases. It has a wide range of possible causes depending upon the site of blood loss and the tissue that is actively bleeding. Indeed, the patient with hematemesis can present in a number of clinical states. Esophageal causes are esophageal varices, Mallory waist tear, most often caused from violent coughing or vomiting. Then erosive esophagitis, esophageal carcinoma, a diagnostic evaluation, bleeding time, liver function test, hemoglobin concentration. There is upper endoscopy, Glasgow, Blatchford bleeding score. GBS score is the short form. It's a screening tool to assess the likelihood that a person with an acute upper